Okay, so hello students, and let us start with this last topic of the FARRE series of anatomy, general anatomy. We'll discuss some hard parts, the bones, and the modules. Okay, chalo, good. So general anatomy, two topics which I tell are always important. Okay, always. एक तो joints है, and the second one is bones. You get an LAQ on joints, LAQ on bones, or you can also get a short answer question on the bones. Like, but I always tell when you prepare one LAQ, there are many SAQs which are prepared, and many SAQs you get ready with them. Okay, so coming to the joints now. What are joints? Joints are articulation between two bones. Then classification of joints, ये short note भी आता है. So how do you classify joints, बच्चों? How do we classify joints? Joints are classified into three main types. बाकी the rest of the things you can always write the regional classification, functional classification. Okay, so joints, basically the important things I'll just revise, are classified into, one is fibrous. Okay, I'll just write this down for you. Fibrous joints. The second one is cartilaginous. And the third one is synovial. Synovial. Okay, fibrous joints, cartilaginous joints, synovial joints. Now, fibrous joints are of three types. Chalo bachcho, if you can answer this, fibrous joints are of three types. You can see me, all of you. Just one moment. Fine. Okay. Hello to all of you. So, fibrous joint, one is sutures. बस ये ब्रॉड क्लासिफिकेशन याद रखिए. दिस ब्रॉड क्लासिफिकेशन: sutures, syndesmosis, and the third one is gomphosis. Okay, so this classification you remember. Now sutures, syndesmosis, gomphosis. So fibrous joints, no movements are possible. Now sutures are found in the skull. Now what are the different types of sutures? You can always elaborate on that. Like those sutures also comes as a short note. Fibrous joints bhi short note aate hain. So sutures can be classified as serrate suture. Serrate. Serrate suture example is, yes, this sagittal suture. Second one is denticulate. Denticulate example क्या है? Lambdoid suture. Third is squamous. Squamous suture means the bones are going to overlap each other. The next one is plain type of suture. Example is palatine process of maxilla. Okay, these are the plain types of suture. And the last one is wedge and groove type of suture. Wedge and groove, what is the other name for this? Yes, can anyone tell me what is the other name for wedge and groove type of suture? Schindlysis. Okay, Schindlysis is a wedge and groove type of suture. What joint does it belong to? Fibrous joints. Plenty of MCQs you get on examples of this joint. So sutures are examples of fibrous joints. And what are the types of sutures? एक serrate suture, sawtooth. Second is denticulate, teeth-like. Third is plain. Fourth is squamous suture. Fifth is wedge and groove type of suture. Example, the other name for this is Schindlysis. One bone fits into the groove of the other bone, right? Rostrum of sphenoid and vomer. That's the example of it. Okay, syndesmosis example. Yes, any guesses? Syndesmosis example: two bones joined by interosseous membrane. Example is the tibiofibular joint, the radioulnar joint, the interosseous membrane, the intermediate, the middle radioulnar joint, the middle tibiofibular joint. These are example of syndesmosis. And the third one is gomphosis. Gomphosis ka example bolo bachcho. Gomphosis is peg and socket. Peg and socket, that means the teeth fitting in the socket. Okay, that's a peg and socket type of joint. ठीक है? एक मिनट, I can see your comments. ठीक है बच्चों, fine. So fibrous joints clear है. Sutures, syndesmosis, gomphosis. Sutures के types लिखने हैं. Syndesmosis is interosseous membrane between the tibia and fibula, radius and ulna. And third is gomphosis, that's a teeth fitting in the socket. Now coming to the second type of joint, cartilaginous joint. बच्चों बोलो. Cartilage joints are of two types. One is primary cartilaginous, the other one is secondary cartilaginous. What is the primary cartilaginous joint known as? Any guesses, bachcho? Primary cartilaginous joint, what is it known as? Yes, synchondrosis. Chondrosis. Synchondrosis. So what is synchondrosis? It's a primary cartilaginous joint. And what happens to the synchondrosis? What is the fate of synchondrosis? Yes, Kruthat, very good. Yes, Sanchayani, very good, very good. Albert Einstein. Bolo, chalo, answer. Cartilage joints are of two types, sutures and cinders. I'm so sorry. Cartilage joints are primary and secondary cartilage joint. Primary cartilage joints are also known as synchondrosis. And what happens to the primary cartilage joints after certain years? They are converted into bone. Okay, the primary cartilage joints are converted into bone, and this process is known as synostosis. Synostosis. So है ना, ये बहुत कॉमन MCQ है. What is the fate of synchondrosis? Or the fate of synchondrosis is, your answer is synostosis, right? So what is synchondrosis? It's a primary cartilaginous joint, and this primary cartilage joint, after certain years, it gets converted into a bone, and this process is what we call as synostosis. Example of primary cartilage joints, yes, bolo. Example of primary cartilage joint, anyone? The xiphisternal joint. Anything else? The joint between the epiphysis and diaphysis. This is converted into a bone. The secondary cartilage joints are also known as symphysis. And these joints are found in the midline of the body. Midline. Example is pubic symphysis, intervertebral joints. Yes? Clear? So this is about cartilage joint. Then synovial joints, you can always elaborate. Synovial joint, ball and socket type of synovial joint, hinge type of synovial joint. Then what else? Condylar type of synovial joints, saddle type of synovial joints. ये सब है ना, types याद रखना, इनके examples याद रखना. This is what is asked. So question comes like this: describe, or enumerate the different types of synovial joints and describe a typical synovial joint. So when you describe a typical synovial joint, what do you write in that? You write the synovial joints. The joint is covered by a capsule. The capsule is lined by synovial membrane which secretes the synovial fluid. For synovial fluid के बारे में लिखना है, you have to write it's a filtrate of blood plasma in which the hyaluronic acid is added, right? Then you have to write the articular cartilage which covers the bones which are present within the joints except the articular surfaces which takes part in the formation of joints. Finally, you have to write about the ligaments within the joints. Okay, so this is what you're going to write in a synovial joint. Draw and label a typical synovial joint. This is what you get. So you have to describe it under the following heads. One is capsule, second is synovial membrane, third is the synovial fluid, the fourth is the articular cartilage, that is hyaline in nature. Fifth is the ligaments within the joints. And finally, you have to write about the applied anatomy of the synovial joint, the effusion वगैरह लिख सकते हो आप उसमें, dislocation of the joints. Yeah, bachcho, so this is what you are going to write in the joints. So describe a typical synovial joints, or draw or label. Yeah, classify joints and describe a synovial joint. ऐसे question आता है. So this is a LAQ. The second question which is asked as far as joints are as far as the LAQ is concerned is the bones, general anatomy, bones. So bones में you have to describe the classification of bones. Classification: long bone, short bone, flat bone, pneumatic bone, right? Irregular bones. And in case examples you have to write about the bones. Then you have to describe the parts of the bones. What is the diaphysis? Yes, can anyone tell me what is diaphysis? Bacho, can anyone tell me what is diaphysis? It's a part of the bone which develops from a primary center of ossification. Like first there's a plate of cartilage, In this plate of cartilage, the bone formation begins. At one point, the bone formation begins. What is this point known as? The primary center of ossification. Correct? And the part of the bone which develops from a primary center of ossification is known as diaphysis. Okay, the part of the bone which develops from a primary center of ossification is known as diaphysis. The part of the bone which develops from the secondary center of ossification is known as epiphysis. Clear? So what is diaphysis? What is epiphysis? You have to write the end of the diaphysis which faces towards the epiphysis is known as metaphysis. And metaphysis is a part where actual the bone growth takes place. Infections are very common in metaphysis because the arteries they undergo a hairpin bend. So infections are very common here that you have to write. Then you have to write the types of epiphysis. Can anyone tell me what are the types of epiphysis? This is very important, comes as a short note, comes as MCQ. Bacho, chalo bolo, what are the types of epiphysis? Anyone? Not able to see your comments. Okay. बोल सकते हो? What are the types of epiphysis, बच्चों? Come on. Okay, very good, very good. So I couldn't see your comments. What are the types of epiphysis? Example is, what are the types of epiphysis? One is pressure epiphysis. Sorry, pressure epiphysis. So what is pressure epiphysis? Pressure epiphysis is seen at the ends of long bones which are subjected to pressure. Ends of long bones which are subjected to pressure. Example is all ends of long bones. Example, the head of femur, the condyles of tibia, the condyles of femur. This is basically the ends of long bones which are subjected to pressure. That type is pressure epiphysis. Second is traction. Okay, bolo bacho, what is traction epiphysis? Epiphysis formed due to pull of the muscles. Muscle pull, the epiphysis which is formed is known as traction epiphysis. Example is greater tubercle, lesser tubercle, greater and lesser trochanter's of femur, the mastoid process, tibial tuberosity. So these are all examples of traction epiphysis. This is what is asked in MCQs also. The third one is atavastic. Atavastic epiphysis. Okay, bachcho, can anyone tell me what is atavastic epiphysis? The epiphysis which is functional in lower animals and it is degenerated in humans. In lower animals, it's a separate bone, and as evolution has occurred, this bone has got attached to some other bone. Example, bol sakte ho, example of atavastic epiphysis is coracoid process. Coracoid process of scapula. Second is os trigonum of thallus or trigonum of thallus. Okay. So what are the types of epiphysis? What is epiphysis? The part of the bone which develops from a secondary center of ossification. That's epiphysis. Types of epiphysis. One is pressure, seen at the ends of long bones subjected to pressure. Example is head of femur, condyles of tibia, condyles of femur. Traction epiphysis formed due to pull of the muscles, tubercles, trochanters, mastoid process, tibial tuberosity. Third is atavastic epiphysis. Epiphysis which is functional in lower animals, degenerated in humans. Example is coracoid process of scapula. Coracoid process of scapula. And the last one is aberrant. Aberrant epiphysis. Can anyone tell me what is the example of aberrant epiphysis, bachcho? Aberrant epiphysis. Example? Yes. Anyone? What is the example of aberrant epiphysis? It's an extra epiphysis. Extra epiphysis matlab additional epiphysis. Example is proximal end of the first metacarpal bone. Sorry, I can't see the comments. Proximal end of the first metacarpal bone. It is an example of aberrant epiphysis. Take it clear to all of you. Okay, fine. Very good, Chinmay. Pruthat, very good. Paridhi, yes. ये comments दिखते नहीं है, so I have to keep on again refreshing it. Fine. So that's epiphysis. Then you have to write about the metaphysis. The part of the diaphysis which faces the epiphysis is known as metaphysis. Okay. Then you have to write the blood supply of the long bone. कभी कभी question आता है blood supply of the long bone, in which you have to describe the arteries which are supplying the bone. One is the nutrient artery which divides into two, goes to the periphery and then gives branches, and these branches undergo a hairpin bend, and the blood flow becomes very sluggish, and that is why infection is very common in metaphysis. Okay, second is metaphyseal arteries. from the plexus which surrounds the joint, the arteries, they go and supply the metaphysis. So one is nutrient artery, second is metaphyseal artery, third is epiphyseal artery, and the fourth one is periosteal artery. So you have to just elaborate this: arteries supplying the bones. Okay, blood supply of a long bone. Now coming to this, bachon, chalo, we'll quickly go through the hard parts. Right, I'll draw this for you, bachon. You can quickly tell me this. Okay, that's a clavicle here. So that's a medial 2/3, lateral 1/3. This is medial and that is lateral. You can see the comments. That's the problem. Chalo, bachon, can you tell me what is the muscle here? Number one. What is this muscle here? Number one. What is this muscle here? Number two. What is this muscle here? Number three. And what is this muscle here? Number four. Chalo, this is a Viva type of thing. You can quickly answer this. Chalo, bachcho. One moment. Chalo, bachcho. What is one? The clavicle medial end is quadrangular, lateral end is flattened. The shaft is convex in its medial 2/3, anteriorly concave in its lateral 1/3. Right, so that is how you identify the side, and the subclavian groove is present on the inferior side. Okay, that's how you identify the side of the bone. Then what are the muscles attached to this bone? Clavicle. What are the characteristic of clavicle that you have to write? Chalo, one is what? One. Sternocleidomastoid nahi hai bacha. One kaun hai? One. Two is deltoid. Right, two is deltoid. This is deltoid. What is three? You should be able to understand the bones now without looking at them. One कौन है? Pectoralis major है बच्चों. One is pectoralis major है ना? Pectoralis major rises from the medial 2/3 of the anterior aspect of clavicle. Fourth कौन है? Fourth is sternocleidomastoid. And below there's a groove which is known as the subclavian groove on the inferior aspect, which gives attachment to the subclavius. Clear? Okay. Clear to all of you? What are the characteristics of this bone? The only long bone placed horizontally. Okay. Ossifies in a membrane, no medullary cavity. The first bone to ossify, and it is pierced by the nerves. Now, which are the nerves which pierce the clavicle? The supraclavicular nerve. Supraclavicular nerve pierces the clavicle. The middle supraclavicular nerve pierces the clavicle. Perfect. Now, coming to this, chalo bachcho, fast you answer. You must be knowing this. That's the scapula here. This is the spine of the scapula. Come on, can you start? Start. What is this? Number one here. I'll just put number two. This is number three here. This is number 4, 5, 6, 7, 8, 9, 10, 11, 12. Chalo, bolo. Come on, bachcho. This is very easy and easy to understand it like this. Chalo, bachcho. Yeah, na comments ka kuch problem hai. I can't see the comments. That's the issue. नहीं तो है ना easy हो जाता है फटाफट revision के लिए. It becomes very easy for me. चलो, one is what, बच्चा? One. Okay, I'll start. Done, all of you. I'll start. One is the supraglenoid tubercle, है ना? So that gives origin to the long head of biceps brachii. Number 2 is the long head of triceps. Long head of triceps. Number 3, किसने लिखा है? Number 3. This is the dorsal aspect of scapula. This is the medial border. That's the lateral border. So what is number 3, bachcho? Number 3 is teres minor. Teres minor. Number 4 is teres major. Number 8 is latissimus dorsi. Latissimus dorsi. Number 5 कौन है? Levator scapulae. 6 is rhomboidus minor. 7 is rhomboidus major. Rhomboidus major. Clear है ना? What is 9? 9 is supra spinatus. What is 10? Infraspinatus. Supraspinatus, infraspinatus. What is 11? I will say, if you articulate the clavicle here like this, if you articulate the clavicle here like this, the 11 will go like this. So what is this 11? Deltoid. And what is this 12? goes here on the pieces. परफेक्ट है बच्चों. Okay, very good. Yeah, so that's the dorsal aspect of scapula. Now coming to the costal aspect of scapula. See, ऐसे है ना, ऐसे bones भी revise करो. And not everything is important what's given in the books. Examiner has got only 5 minutes for a student, and the viva is based on that. So important things याद रखना बच्चों. That is only asked. See now, what is this surface of the scapula? ये है coracoid process. That's the acromion process. So this is the costal surface of the scapula. What is this muscle here on the costal surface? Subscapularis. That's a subscapularis, correct? Now, bachcho, what is this muscle? Can anyone tell me what is this muscle here? What is this muscle? And what is the muscle which begins from the coracoid process? Yes, very good to all of you. Very good. What is this muscle attached to the costal surface of the scapula medial border? What is that? That's the serratus anterior. Costal surface, medial border, serratus anterior. On the costal surface is the subscapularis. Attached to the coracoid process are three muscles. Coracoid process always asked, what is the type of epiphysis? Atavistic type of epiphysis. And what are the muscles attached to the coracoid process? Number one, the short head of biceps and the coracobrachialis, and the insertion of pectoralis minor, right? Coracobrachialis and short head of biceps begins from the tip of the coracoid process. The pectoralis minor is attached to the coracoid process, inserted. Clear? Scapula clear, hai na? So scapula is a very easy bone. Remember that. So we'll start with this now. ऐसे याद रखना बच्चों, there's no need to read separately the bones here. That's a greater, lesser tubercle, greater tubercle. That's a medial lip of bicipital groove, lateral lip of bicipital groove. Chalo, we'll start with this. Tell me what is attached to this. Number one, what is attached to this? The greater tubercle. What is attached to the medial lip? What is attached to the lateral lip? What is in the bicipital groove? Okay. What is this muscle number 6? Wait, let me finish this. Number 6. What is this muscle number 7 and number 8? This is number 9. This is number 10. और कुछ बाकी है? And what is this number 11? चलो बच्चों, come on. Very good, very good. Sanchayani, okay, great. Now I can see the comments now. Okay, great. Sanchayani, bolo bacha. One कौन है? One is the lesser tubercle, bacha. One is the lesser tubercle. One is lesser tubercle. Two is greater tubercle. One is lesser tubercle. So what is attached to the lesser tubercle? What is attached to the lesser tubercle? Subscapularis. Number one is subscapularis, bacha. Two is what? Two is greater tubercle. Greater tubercle के 3 impressions है. Okay, that is 1, 2 and 3. Supraspinatus, infraspinatus, teres minor, right? What is attached to 2? Greater tubercle is 2. Supraspinatus, infraspinatus, teres minor. What is attached to number 3? Yes, number 3 कौन है? Number 3 pectoralis major नहीं है बच्चा. Hey, this is medial बच्चा. This is lateral. Don't get confused. ये medial है, ये lateral है. अब बोलो. Number 3 is the medial lip of bicipital groove. And what is attached to medial lip of bicipital groove? Teres major, right? Teres major. What is attached to the lateral lip of bicipital groove? Pectoralis major. And what is in the floor of the bicipital groove? Latissimus dorsi. And what lies on the latissimus dorsi is the long head of biceps brachii. Long head of biceps brachii. ठीक है? Okay, number 11 बोल सकते हो कोई? Number 11. What is number 11? 11 is a muscle which is attached to the medial aspect of the middle half of the shaft of humerus. 11. Number 11. Medial aspect of the middle half of the shaft of humerus. 11. Number 11. I'm asking. Number 11 बोल रहा हूं. Yes, बच्चों बोलो. 11 is coracobrachialis. Very good. 11 is coracobrachialis. Coracobrachialis begins from the tip of the coracoid process along with the short head of biceps brachii attached to the medial aspect of the middle half of the shaft of humerus. That's coracobrachialis. Number 6 कौन है बच्चा? 6 is brachialis. Okay. 6 is brachialis. See, if you know this, you automatically know the origin of muscles. Brachialis arises from the anteromedial and anterolateral aspect of the shaft of the humerus below the attachment of coracobrachialis. Correct. What is number 10? Number 10 is common flexor origin. Common flexor origin. Number 9 is common extensor origin. Common extensor origin. ठीक है. 7 8 कौन है बच्चा? 7 and 8. 7 and 8 किसी ने लिखा है? नहीं. So what is number 7? What is number 8? So today we are discussing the general anatomy topics. I've told you what are important joints and bones. Now we're discussing the important hard parts. तो बस इतना याद रखना आपको. What is number 7, बच्चा? Number 7 is a muscle which begins from the lateral supracondylar ridge of the humerus. Lateral supracondylar ridge of the humerus. There are two muscles which begins. Number 7 कौन है बच्चा? Brachioradialis. Number 7 is the brachioradialis. And number 8 is extensor carpi radialis longus. हाँ, brachioradialis, radiobrachialis विनय, brachioradialis, and 8 is extensor carpi radialis longus. Clear है बच्चा? Okay, very good. Can anyone tell me what is this thing that I've drawn here? What is this structure that I've drawn? I've drawn a structure which lies between the brachialis, the brachioradialis, and ECRL. What is this structure? Anyone? Anyone? Answer this. I've drawn, okay, what is that structure? Bolo, if you're not able to identify, I'll give you a hint. What is that yellow structure? Any guesses? Nerve hai wo, nerve, radial nerve. Very good, Sanchayani, very good. That's a radial nerve, no, bacho, that's a radial nerve. The radial nerve, where does it lie? It lies between the brachialis, the brachioradialis, and the extensor carpi radialis longus, correct? And if I draw a nerve here lying on the brachialis, what is this nerve? Ye hai radial nerve. And what is this nerve? Can anyone tell me what is the other nerve that I've drawn here? The nerve which lies on the brachialis and it lies below the biceps. अब biceps को हमने निकाल दिया. We've removed the biceps from here. When you remove the biceps, yes, you see the brachialis. So what is that nerve which lies between the biceps and the brachialis? What is that nerve between the biceps and the brachialis? That's the musculocutaneous nerve. Musculocutaneous nerve. Between the biceps and the brachialis lies the musculocutaneous nerve. That's okay. That's okay. Huh? Fine. This is clear to all of you. And the nerve behind the medial epicondyle is ulnar nerve. Behind the medial epicondyle is ulnar nerve. The nerve which winds around the neck of the humerus is axillary nerve. Axillary nerve. Okay. Okay, bacha. Now you tell me what is this that I'm drawing? So what is this muscle which arises above the spiral groove, and what is this muscle which arises from the shaft of the humerus below the spiral groove? So this is the posterior aspect of the humerus. So what is this here and what is this here? Anyone? The nerve, the muscle which arises above the spiral groove and the muscle which arises from the shaft below the spiral groove. So ye hai lateral head of triceps, and that's the medial head of triceps. Lateral head of triceps and medial head of triceps. Okay. ठीक है ना? तो तीन head of triceps are clear. The long head arises from the infraglenoid tubercle, lateral head above the spiral groove, medial head below the spiral groove. The medial head of triceps is the largest head of triceps. It's the big head of triceps. And this medial head of triceps receives nerve supply twice. एक बार axilla में, and the second one is in the spiral groove. So the medial head of triceps is supplied twice by the radial nerve. Remember this, once in the axilla, the radial nerve supplies the medial head, and secondly, it supplies in the spiral groove. Why? Because the medial head is the largest head of triceps. Okay, just remember this. Okay, easy enough. That's how you remember everything. Tell me now, bacha, what is this for the humerus? I mean, what is this for the radius? That's the head of the radius. That's the neck of the radius. That's a radial tuberosity. Radial tuberosity. What is the type of epiphysis? If that's a question asked. Radial tuberosity. Have I not told you? Any elevation which is formed on the bone. What is the type of epiphysis? It's formed because of the pull of the muscles. So this is an example of traction epiphysis. The radial tuberosity is an example of traction epiphysis. That's the ulna here. Okay, let me just draw this for you. and that's the ulnar tuberosity. Chalo bachcho, can anyone tell me what is this number 1 that I've drawn which is attached to the radial tuberosity, and what is this number 2 attached to the ulnar tuberosity? Chalo bachcha, come on, answer this. Number 1 attached to the radial tuberosity is the biceps brachii, है ना, biceps brachii, and attached to the ulnar tuberosity is what? Brachialis. Okay, so this is biceps brachii and that's the brachialis. Chalo bachcho, now you tell me, देखो कैसे याद रखते हैं? There's a muscle attached here on the lateral aspect of the shaft of the radius in its middle half. मतलब radius को भी divide into two half. There's a muscle attached to the lateral aspect of the shaft of the radius. There's a muscle attached just above the styloid process on the lateral aspect, and there's a muscle here which is inserted on the radius. Chalo, can anyone tell me what is this A, B and C? Chalo bacha, you should be able to answer this. Understand it like this, bones are very easy. Baki, you just have to identify the side of the bone. Side identify karna hai, upper and lower end, medial side, lateral side, anterior, posterior. If you are able to identify it like that, you will be able to identify the side of the bone. And radius and ulna saath mein padho bacha. Radius and ulna, read it together. Read it together. Okay, what is A? A कौन है? A. बोलो बच्चा, come on, come on, come on. Just try, think and answer. You should be knowing this. Okay, I'll just make this for you. One moment. ऐसे याद रखना. बोलता हूँ. Immature scalpel. See, this is how you remember, bacha. I'm telling you a very easy way to remember this. So hard parts. A is supinator. Excellent, very good. A is supinator. A is supinator. Supinator begins from here, the supinator crest of ulna. Supinator begins from the supinator crest of ulna, goes behind the radius and gets inserted on the lateral aspect of radius. What's B? B is pronator teres. B कौन है? Pronator teres. And what's C? C is brachioradialis. A is supinator, B is pronator teres, and C is brachioradialis. But you have to know this. This is always asked in the exams, right? Now, what is this number D? ये D कौन है? E कौन है? F कौन है? Can anyone answer this? What is D? D is a muscle which begins from the radius, goes to the thumb, causes flexion of the thumb. What is this? Flexor pollicis longus. What is E? The flexor digitorum profundus. And what is F? The pronator quadratus. Pronator quadratus. And what arises from here? Anterior oblique line. Can anyone tell me? Anterior oblique line gives origin to what? The anterior oblique line gives origin to, any guesses? The flexor digitorum superficialis. Anterior oblique line gives origin to the flexor digitorum superficialis. Perfect. So that's how you understand the radius and ulna, anterior aspect of radius and ulna. So radius, lateral aspect पे supinator, the pronator teres, the brachioradialis. आगे is anterior oblique line is flexor digitorum superficialis, below is flexor pollicis longus and pronator quadratus. And the same on that of ulna. Ulna पे flexor digitorum profundus है, and this is pronator quadratus. Clear to all of you? And now if you see the radius and ulna from a posterior view, see, posterior aspect of radius and ulna, कैसे याद रखते हो? See, this is very easy. And same diagram you draw for the anatomical snuff box. Same diagram you draw for anatomical snuff box. There's a muscle which begins from both radius and ulna. Can anyone tell me a muscle which begins from both radius and ulna? That is abductor pollicis longus. A muscle which begins from radius alone, that is extensor pollicis brevis. A muscle which begins from the ulna, extensor pollicis longus. What is this? Extensor indicis. Extensor indicis, and there's a muscle here, supinator. That's supinator. Okay, so just remember the anatomical snuff box based on this slide. The same slide you have to draw for the anatomical snuff box. Clear? A muscle which begins from both radius and ulna, that's the abductor pollicis longus. From the radius, extensor pollicis brevis. From the ulna, extensor pollicis longus. Below it, extensor indicis and the supinator. These are the deep muscles on the back of the forearm. The nervous posterior interosseous nerve. That's how you remember this. Now, these two muscles go together and this muscle goes alone. That's a snuff box. Okay, na? So that's how the boundaries of the snuff box is. I'll tell you, immature scalpel last day ka revision kaise karne ka I'll tell you. Let me just finish this. Okay. So these are the bones of the upper limb that you need to know. The same bones will be asked in radio also. Radio maybe hoga. So you just see the bones. This is the humerus. This is the greater tubercle, lesser tubercle. Everything will be normal. So nothing abnormal there in the x-rays. So just remember, this is a plain x-ray of shoulder joint or elbow joint and the bones which are seen that you have to tell. And if it's a special x-ray, you have to tell it as hysterosalpingogram or pilogram, ascending descending pilogram, or barium meal, barium swallow, barium follow through, or barium enema. Okay, right. सबका एग्जाम 2 अगस्त को है बच्चों. ईशान, everyone have the exam on 2 August only. Okay, that's the head of the radius, that's the neck of the radius, that's the greater trochanter, that's a femur, not radius, femur. Okay, that's the condyles of the femur. Chalo bachcho, if you can answer this now for me. That's the head, that's the neck, that's the greater trochanter. Piche hoga lesser trochanter. On the posterior aspect is lesser trochanter. That's the shaft. These are the two condyles. Okay, femur. Chalo, can anyone tell me what is attached to the greater trochanter lateral aspect? What is attached to the greater trochanter anterior aspect? A and B. Chalo, answer this. Fatapat will finish this. Come on, bachcho. Answer this. What is attached to the anterior aspect of the greater trochanter? What is attached to the lateral aspect of the greater trochanter? The same thing, muscles we are revising. We are revising the bones here. Whether you study the muscles or whether you study the bones, it's the same thing. A बोल सकता है कोई, what is A? On the anterior aspect of the greater trochanter of femur, what is the muscle attached? A is gluteus, yes, minimus. B is gluteus medius. Gluteus minimus, gluteus medius, right? No? Then you've got this spiral line here. What is this muscle which arises from the anterior aspect of femur? That's the vastus intermedius. Vastus intermedius. From the medial aspect of this intertrochanteric line, the intertrochanteric line then becomes the spiral line behind. Okay, so medial aspect and the lateral aspect of intertrochanteric line. This is vastus medialis. This is vastus lateralis. Intertrochanteric line है, पीछे जाके वो spiral line बनता है and then it continues as the medial lip of the linea aspera. On this side is the delta, is the gluteal tuberosity, gluteus maximus. Gluteus maximus, fine. Clear now? Popliteus, groove for popliteus याद रखना. Lateral condyle, above that is the lateral epicondyle. Just below the lateral epicondyle of the femur, you get the groove for popliteus. Groove for popliteus. Okay. Now, if you can tell me this, students, that's a tibia, that's a fibula, just the posterior aspect. I'm telling you, what is this line on tibia? Students, this is extremely important. Understand this. This is the soleal line. The soleal line on the tibia. Come on, bachcho, tell me what is this muscle number 1, which is here? What is this number 2? What is this number 3? What is this number 4 muscle here? Number 5. And this is the soleal line number 6. Soleal line gives attachment to the soleus. What is number 1? Chalo bachcho, can anyone tell me what is number 1 here? Number 1. Number 1 is a muscle which begins from the femur. Excellent. Very good, Sanchani. Excellent. This is the, yes, this is the popliteus. Number one is the popliteus. Number two tibialis posterior nahi hai. This is tibialis posterior. Number three is tibialis posterior. Number two is the flexor digitorum longus. Number four is the flexor hallucis longus. And number five is the biceps femoris. Biceps femoris. ठीक है बच्चों, don't be scared for the exams. You know everything. You've answered very well. Your concepts are very good. Okay, have confidence बच्चों, have confidence. ठीक है. So about the soleal line of tibia is the attachment of popliteus. Then divide the tibia and the fibula into two halves. From the posterior aspect is the tibialis posterior. Medial aspect of the shaft of tibia gives origin to flexor digitorum longus. Lateral aspect of shaft of fibula gives origin to flexor hallucis longus. And the styloid process gives attachment to the biceps femoris. And what is here? The nerve which winds around the neck of the fibula is the common peroneal nerve. Common peroneal nerve. Okay. फिर vertebrae रखते हैं. Vertebrae. How do you identify thoracic vertebrae? चलो बच्चा, cervical vertebrae, thoracic vertebrae, lumbar vertebrae. How do you know this is the cervical vertebrae? How do you identify this as cervical vertebrae? Presence of facet for the attachment of rib. So presence of a facet on the body of the vertebrae, presence of facet on the transverse process for the attachment of tubercle of the rib. So the moment you see the thoracic vertebrae, बच्चे बोलते हैं heart-shaped body. That's not the first point to identify. The first point what you have to answer is present of a facet or a demi-facet on the body of the vertebrae and presence of a complete facet on the transverse process of the vertebrae. So this is a thoracic vertebrae. Then you say heart-shaped body and all. Cervical vertebrae, what is the identifying points? Do not say kidney-shaped body. No, that's not the first point of identification. The first point of identification is presence of foramen transversarium in the transverse process. Okay, that's the first point. So cervical vertebrae दिखाते हैं. So presence of foramen transversarium. Very good, Vinay. In the transverse process, and what passes through this is the vertebral artery. Second is the spine is bifid, and this bifid spine is filled with a ligament which is known as ligamentum flavum. ठीक है ना? Lumbar vertebrae, body is large. All that you can say. First rib is very important, bacha. First rib is very important. First rib, that's the head of the rib, that's the neck of the rib, that's a tubercle of the rib, and that's the shaft of the rib. So first rib ka side identification is very important. The head should be towards you, and the shaft should be facing anteriorly, and then you put it on the table. वो बच्चे क्या करते हैं, हाथ में पकड़ते हैं first rib. No, you have to put it on the table. The head as well as the shaft has to touch the table. It's of that side. If the head and the shaft is pointing upwards, it's not of that side. It's of opposite side. ऐसे याद रखना. Relations of the neck of the first rib. Bacha, this is another very important thing which is asked here. I'll just put this for you. Relations of the neck of the first rib. From medial to lateral, it's SVAN. बोल सकता है कोई SVAN. Relations of the neck of the first rib. Come on, students, can you answer this? What is S? Sympathetic chain. V is the first posterior intercostal vein. A is the superior intercostal artery. And N is the first thoracic nerve. First thoracic nerve. So this is how you identify the relations of the neck of the first rib. ठीक है? This is very commonly asked. First rib is extremely important. है? देखो 2-3 bones है ना, अच्छे से पढ़ के जाना. Given a choice, you always take those bones. So relations of the neck of the first rib: sympathetic chain, the first posterior intercostal vein, the superior intercostal artery, the first thoracic nerve. What is attached here? Here there's a tubercle on the first rib. Here, what is attached to this? This is the scalene tubercle. Muscle है scalenus anterior. What is attached to the first rib on the posterior aspect? That's a scalenus medius. What is attached to the outer border of the first rib? That's a serratus anterior, right? And what is attached to the inner border of the first rib? That's the Simpson's fascia. Simpson's fascia. ठीक है? Scalenus anterior to the scalene tubercle anteriorly, scalenus medius attached posteriorly, serratus anterior to the outer border, and the Simpson's fascia attached to the inner border of the first rib. Perfect. Then what are the joints formed by the ribs that you have to know? Costovertebral, costotransverse, costochondral joint. And the movements of the rib, the bucket handle movement, the pump handle movement, ये सब आना चाहिए. ठीक है बच्चों, this is extremely important. A quick go through this. I'll just quickly revise this for you. Okay, you should be able to revise the bones like this without looking at the bones. Right. Chalo, bachcho, will start. What is this? Can anyone tell me? That's the interior of skull. Interior of skull, what is this known as? So automatically your theory is also getting done. So what is this? The first thing that I've drawn, that's a cribriform plate of ethmoid. What passes from here is the olfactory nerves. What is this number 2 that I've drawn for you? That's the optic canal. Optic canal. What comes in from here? The optic nerve, and what gets out from here is the ophthalmic artery. Ophthalmic artery. Yes, skull is skull. What is this? This is the anterior cranial fossa. That's the middle cranial fossa. That's the posterior cranial fossa. Right? Anterior cranial fossa, middle and posterior cranial fossa. What is this structure? This is the lesser wing of sphenoid. That's the petrous part of temporal bone. The lesser wing of sphenoid, the petrous part, divides the skull into three fossae. That's the anterior, that's the middle, and that's the posterior cranial fossa. Anterior cranial fossa, what is this? Cribriform plate of ethmoid bone. Very good, Veena. What passes to this is the olfactory nerve. Second is the optic canal. What passes from here is the optic nerve and the ophthalmic artery. What is this, bacha? Sympathetic chain. Acha, okay. What is this? That's the superior orbital fissure. Lesser wing of sphenoid के नीचे क्या होता है? Superior orbital fissure. And this superior orbital fissure comes as a short note, बच्चों. This superior orbital fissure is divided into three parts by a common tendinous ring, right? Common tendinous ring. What passes to the lateral compartment of the superior orbital fissure? That's the lacrimal, frontal, and trochlear nerves. Lacrimal nerve, frontal nerve, and trochlear. What passes to the middle compartment? These are the two rami of the oculomotor nerve. This is the nasociliary in between and the abducens here. And through the medial compartment, what passes is the inferior ophthalmic vein. Very good, very good. Sanchini. The superior orbital fissure is divided into three compartments by the common tendinous ring or the ring of Zinn. Lateral compartment, lacrimal, frontal, trochlear. Middle compartment, the two rami of oculomotor nerve. Beach mein is nasociliary and the abducens, and the medial compartment, what passes is inferior ophthalmic vein. Perfect. That's a pituitary fossa here. What lies here on either sides here? That's a cavernous sinus. Now, bacho, what is this foramen? This is number Chalo, can anyone tell me what is this? 3, 4, 5 and 6. Bas itna yaad rakho. This is what is asked of the skull. What is number 3? That's a foramen rotundum. Foramen rotundum. What passes to foramen rotundum is the maxillary nerve. Number 4 is foramen ovale. What passes to foramen ovale is MALE. This you must be knowing. Mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissary vein. Right? Mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissary vein. What is number 5? Foramen spinosum. What passes to foramen spinosum is the middle meningeal vessels and the nervus spinosus. Middle meningeal vessels and the nervus spinosus. Very good. What is number 6? Foramen lacerum. What passes to foramen lacerum is the internal carotid artery and the sympathetic plexus around the internal carotid artery, the deep petrosal nerve. Okay, that's great. Very nice. What is this? That's a petrous part of temporal bone, and there's a foramen right here in the petrous part of the temporal bone. What's that? Internal acoustic meatus. And what passes to the internal acoustic meatus is the 7th nerve, the 8th nerve, and the labyrinthine artery. 7th nerve, 8th nerve, and labyrinthine artery. Right, that's internal acoustic meatus. Veena. What is this big foramen? That's a jugular foramen. And jugular foramen ke 3 compartments hai, bacha. This you should know and answer it like this. Jugular foramen is very commonly asked in the exam, so you answer it as anterior, middle, and posterior compartments of jugular foramen. What passes to the anterior compartment of jugular foramen is the inferior petrosal sinus. What passes to the middle compartment is the 9th, 10th, and the 11th cranial nerves. And what passes to the posterior compartment of the jugular foramen is the sigmoid sinus. Sigmoid sinus, right? So anterior, middle, and posterior. Anterior is inferior petrosal sinus. Middle compartment is 9, 10, 11 cranial nerves, and posterior compartment is the sigmoid sinus, which gets out, continues as the internal jugular vein, right? And that's the foramen magnum. There's a foramen here. What is this known as? Hypoglossal canal. Hypoglossal canal is also known as the anterior condylar canal. And what passes to the hypoglossal canal is the hypoglossal nerve. Hypoglossal nerve. Perfect. Now, this foramen magnum is divided into two compartments by the, what is that ligament known as? The alar ligament of Dens. The alar ligament of Dens divides the foramen magnum into an anterior and posterior compartment. What passes to the anterior compartment of foramen magnum is the tip of the Dens, the apical ligament of Dens, and the cruciate ligament. Okay, so three structures: tip of the Dens, apical ligament of Dens, cruciate ligament. What passes to the posterior compartment of jugular foramen is the lower part of the medulla and the meninges. Lower part of medulla and meninges, the spinal accessory nerve, vertebral artery and veins, the anterior and the posterior spinal arteries, and the tonsils of the cerebellum. Hi Deepak, I'm fine. Clear to all of you? Very good. Excellent. Now the other thing that you get is a very common question, styloid process. ये ना बहुत बार दिखाते हैं एग्जाम में ना styloid process, and they ask you what is attached to the styloid process. A styloid apparatus comes as a short note for you बच्चों. So styloid process पे there are muscles and there are ligaments which are attached. Now which are the muscles attached to the styloid process? That is stylohyoid muscle, pharynges, and third is styloglossus. Okay, muscles attached to the styloid process: stylohyoid muscle, stylopharynges, and styloglossus. Bolta Vina. Just 2 minutes. I'll finish this, then we'll discuss. And ligaments are stylomandibular ligament, and stylohyoid ligament. Stylomandibular and stylohyoid. Chalo bachcho, quickly tell me the nerve supply. Nerve supply of stylohyoid, stylopharynges, styloglossus. Come on, bachcho, come on. Stylohyoid. What is the nerve supply of stylohyoid? Any guesses? Any guesses? No guesses. Now you should be able to answer. Yes, bolo bachcho, come on. Stylohyoid and posterior belly of digastric. They are supplied by one nerve. Stylohyoid and posterior belly of digastric are developed from the second pharyngeal arch. The nerve is facial nerve. Stylohyoid and posterior belly of digastric derive from the second pharyngeal arch. The nerve is facial nerve. The anterior belly of digastric and the mylohyoid is supplied by mandibular nerve, first pharyngeal arch. Stylopharynges is glossopharyngeal nerve. Stylopharynges is supplied by glossopharyngeal nerve. It's a nerve, third pharyngeal arch, and third pharyngeal arch में एक ही muscle है, that's stylopharynges, and styloglossus is supplied by hypoglossal nerve. Styloglossus is supplied by. Okay, clear to all of you? फिर बच्चों, remember all exceptions in the exam. So this is extremely important. Exceptions, like all the muscles of the tongue are supplied by hypoglossal nerve except palatoglossus, which is supplied by pharyngeal plexus or vago-accessory complex. Coming to the soft palate, all the muscles of soft palate are supplied by pharyngeal plexus except the tensor palatii, which is supplied by the mandibular nerve through the nerve to medial pterygoid. All the circular muscles of pharynx are supplied by pharyngeal plexus except the cricopharyngeus part of inferior constrictor, which is supplied by external or recurrent laryngeal nerve. Right? Anything else left? Tongue ho gaya, soft palate ho gaya, pharynx ho gaya. Larynx. All the muscles of larynx are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. The sensory supply of the larynx below the vocal folds is recurrent, above the vocal fold is internal laryngeal nerve. ठीक है बच्चों, बाकी AETCOM cadaver as the first teacher you can write. Everyone knows what to write in cadaver as the first teacher, but you don't make the examiner घुमा मत examiner को. Write to the point how the cadaver has helped you, how the cadaver is going to help you in future, what you have learned from the cadaver, how you respect the cadaver. Okay, all those things you are well versed with. And the second is role of physician, or what are the duties of the physician when you become a doctor. What duties are you going to do towards the society, okay, and towards humanity. So this is what you're going to, 2 questions of AETCOM which are asked for you, and those are meant for passing, right? Those 2 questions are meant for passing. Bachcho, baki see, we have revised literally everything, right? So the most important thing, paper 1, paper 2 hai above the diaphragm, below the diaphragm. Now different universities follow different pattern. राइट। अपर लिम में लुक नाउ एक क्विक रिव्यू देता हूँ। अपर लिम में nerves are very important. Medial nerve, ulnar nerve, radial nerve, extremely important. मसल्स में the biceps brachii है, serratus anterior है, हाँ, deltoid है, trapezius है. Those muscles are very important. And then LQs आता है shoulder joint, the first carpometacarpal joint, right? Then spaces of the hand. Those topics are important. Flexor retinaculum, carpal tunnel, right? Lower limb, hardly 5-6 topics are very important. उसमें arches of foot है, venous drainage of lower limb है, ठीक है बच्चों? Femoral triangle, adductor canal, popliteal fossa, and then muscles are important. Sartorius हो गया, gastrocnemius हो गया, or the tendoachilles tendon, popliteus, locking, unlocking of knee joint, inversion and eversion of foot. Standard questions है बच्चों. Just read all these things. Femoral sheath, femoral canal, femoral ring. Okay, so automatically your MCQs are also answered. Thorax में intercostal space is a very very important LQ, and when you prepare intercostal space simultaneously you prepare azygous vein, उसके साथ azygous vein हो जाता है. Then pleura is very important. Lungs, bronchopulmonary segments are important. Heart, the coronary circulation is very important. Okay, LQ you always get on coronary circulation, arteries and veins उसमें लिखना है. Interior of right atrium is what is asked. And then development of interatrial interventricular septum, the aortic arch arteries, that is extremely important, and diaphragm, origin, insertion, nerve supply, action, and development of diaphragm. That is what is expected from you. Abdomen में anterior abdominal wall, rectus sheath, very important. Inguinal canal, coverings of testes, peritoneal reflections, the greater sac, lesser sac, epiploic foramen, root of mesentery. Then we come to the organs. उसमें duodenum, stomach है, duodenum है, pancreas. These three are extremely important organs. Kidneys है, spleen, right? Development of IVC, development of SVC is another important thing. And as we come, uterus is very important. Rectum, anal canal is important, bacha, and urinary bladder. Okay, relations of this structures are very important. Ligaments of this organs are very important. Broad ligament, round ligament. Clear? ये सब पढ़ लो. And contents of broad ligament पढ़ लो. What are the positions of uterus that you have to know? Anteversion, anteflexion, the blood supply of the uterus. And bladder के relations in males and females. The posterior part of the bladder, the base of the bladder, in males is separated from the rectum in the upper part by the rectovesical pouch, है ना? And in the lower part, the base of the bladder is related to the vas efferents, the seminal vesicles, the ejaculatory duct. So that's how you understand the bladder ka relations. In females, it is related to the vagina and the supravaginal part of the cervix. Ligaments of bladder पढ़ लो बच्चों. Lateral ligament, anterior, posterior ligaments of bladder. Uterus and rectum. Rectum नहीं, anal canal is important. The 38 millimeters, how you divide this 38 millimeters, ischiorectal fossa is important. Clear? And then head and neck. The triangles, the posterior triangle of the neck, ansa cervicalis, branches of external carotid artery, ansa cervicalis I told you. Then all those glands, thyroid gland, parotid gland, submandibular gland is not that important, but just go through it once. Extraocular muscle, short note आता है. Middle ear, you get as an LAQ, middle ear. Pharynx, muscles of the pharynx comes as short note, larynx comes as an LAQ. ठीक है बच्चा? Cavernous sinus is extremely important, a cavernous sinus, right? And embryology, development of face that we have discussed, all these things you read. And nerves, the pharyngeal arches, like first pharyngeal arch, or any defects of the first pharyngeal arch, like Treacher-Collins syndrome and all, that can be asked. And neuroanatomy, the cranial nerves, usme bhi 7, 9, 12, you should know. Baki 3, 4, 6, you can go through it. Supralateral surface, functional areas, blood supply, circle of Willis, venous drainage of brain, ventricles, brainstem, sections of the brainstem, the various syndromes, and cerebellum, thalamus. This is what is expected from you. Bachcho, anything else you want to ask, you can ask. Okay, so that was a quick revision. This FARRE series, I hope it was beneficial to all of you, bacho. And wishing you all the best from the entire team of PW. All the best. Anything else that you want to ask me, you can ask. Yes, Sanchani, Veena, and the day prior to the exams, बस don't go through the entire book. हाँ, एक skeleton बना होगा ना आपने, like shoulder joint. So उसमें what points you're going to write in the exam, just go through those points. No need to go through the entire book. Like bone stacking part. Second is the various ligaments, the capsular ligament, then coracohumeral ligament, all those like this. Then relations, movements, muscles producing movements, blood supply, nerve supply, and usme thoda thoda you have to remember so you can elaborate in the exams. Okay, can I see your comments? Yes, bacho. Anything else that you want to ask, you can ask. बाकी bones भी just identify the side and not and the examiner will point you what is to be told. Yes, Ishan. Now you must have done everything. Krutha ठीक है, वीना, परिधि और कौन है? ओके बच्चों, और कुछ पूछना है? Anything else you want to ask, you can ask. And slides, histo, I've told you what things you have to remember. Even if a short note comes of histology, just write those things, elaborate thoda sa kariye, draw beautiful H&D diagram. That's enough. Clear? Fine, bachcho, we'll stop here then. Thank you to all of you. Thank you for this patient listening of the FARRE series, specially made for you. And all the best. Once again, all the best. Okay, we'll stop here. संचयनी ठीक है ना? अरे बोलो, कुछ तो बोलो. We'll stop. कुछ किसी को कुछ पूछना है? Anyone wants to ask anything, you can ask. And draw diagrams with colored pens. Huh? Colored pens are allowed. Huh? Standard है वो. Brown for muscle, green for fascia, yellow for nerve, pink for artery, blue for vein. Standard colors hai. You can use colors in the exams. And draw directly with colors, put it in a bracket, write the name of the slide below it and label on the sides of the bracket. Chalo bachcho, thank you my dear children, thank you to all of you, God bless you all, have a very pleasant night and all the best, come with flying colors. Thank you.